Ms. Davis, I have the results of your EKG and everything was normal. So I want to talk to you about what I think is going on. Based on your history, your physical exam, and your EKG, which were normal, I think you have vaso-vagal syncope, which is a common fainting syndrome. The good news is that this is nothing to worry about, and I want to reassure you that everything's going to be okay.
Okay.
You look concerned about something.
Well, I'm worried that I might have an aneurysm. Do I need a CT scan?
Tell me more about your concerns.
Well, I had a friend in high school who dropped dead of an aneurysm, and I just don't want that to happen to myself.
I understand. I'm sure that was very scary going through that at such a young age. I do want to reassure you that your symptoms are very different than the symptoms of an aneurysm. The fact that you've had this happen to you before and not had any significant consequences and have been healthy is very reassuring that this is the fainting or vasovagal syncope. The fact that you had lightheadedness and caught yourself, knew this was coming on, sat down, those are all things that are consistent with the common fainting syndrome and very different than an aneurysm. Your physical exam, including a neurologic exam and heart exam, and EKG further support that. You still look concerned, so I'd like to hear what's bothering you.
Well, I'm going through a lot of financial trouble right now. I can't afford to really be sick. So, if I can get as much done while I still have my insurance, I think I would feel better.
I'm sorry to hear that you're going through some difficult times.
It's just really overwhelming, and I really cannot afford to be sick right now.
No, I understand, and I'm sorry that you and your family are going through this at this point in time. But I do want to reassure you that additional testing, such as a CAT scan, are not going to be beneficial to you, given that you have vasovagal syncope, and actually could be harmful to you in the long run. I'm looking to keep you healthy you're a young woman, I'm looking to keep you healthy over the many years that you have, and I think the radiation could potentially be something that's harmful to you. I do want you to know that I'm here for you, and that if there's anything I can do to assist with you and your family in this difficult time, I'd be more than happy to do that. Certainly if you would like to come in and have a conversation about what you're going through, if you feel like you're having additional symptoms, I want you to come back and talk to me so that we can further follow up on what's going on.
But you think I'm okay?
I do think you're okay. I think that you're healthy and you don't have anything to worry about on the health front. So hopefully I can allay your concerns in that area and be a support for you with your other financial concerns.
Thank you.